Hello and namaskar. I'm grateful to you all for giving your time to get together with us and share this beautiful evening or morning, depending upon your time of zone. We have a great discussion. We have a plethora of specialists from across the globe with diverse experience and all extremely focused and expert in the field of providing care to children with type 1 diabetes. So it's going to be exciting. You listen to their views, and I think you'll get plenty of time in the end, towards the end, to also ask your questions and answers. Let me begin by introducing Dia Champs. These are the champions, diabetic children from Haridwar Kankal, who, under the patronage and expertise of Dr. Swami Shivkumar, Swami Dayadhipananda ji, who is also the superintendent of the Ramakrishna Hospital and an MBBS doctor and a diabetes specialist, who has taken care of these children. And I had the personal pleasure of seeing and interacting with some of them on my visits to Kankal. And these children have started with the hospital and learned the integrative medicine techniques and have gone on to actually convert their adversity into an opportunity and adopt a yogic lifestyle, which has really blossomed their creative self, and they have gone on to really enjoy the purpose and meaning of their life. A very inspiring tale, and please listen to the story of these beautiful diachams in their own words.
Myself Surbhi Chaudhary, and I'm type 1 diabetic for the last 14 years. I'm doing masters in science. It was a shock to my family that a child can also get diabetes. So at that time, by luck, I can say I've got diagnosed with diabetes, and I've got admitted to Ramakrishna Mission Haridwar. And over there, Dr. Santosh Gupta started visiting over there from US, and she started making a group of all the type 1 diabetics, and I was the very first child. So from the very starting, I can say I'm in very safe hands, and I feel very proud of that, because so many kids come to us when they get severe complications. They don't know what to do at that time, but from the very starting, I'm in very safe hands. So when I started my treatment, I was just doing what I've been taught about diabetes, that you have to take insulin 4 times a day, and you have to check your blood sugar thrice a day, and you have to take a proper diet. So I was continuing that, but they also encouraged me to go for yoga and exercise. So I started doing that too. So I have noticed that my insulin requirement, total insulin requirement, has reduced from 60 to 50 after including exercise in my routine. So that was also kind of happiness for me, that yes, my insulin requirement is decreasing, that I'm doing something good with it. So after that, I came to know about a special diet, I can say, which I'm following from the last 15 days. We can call it as a integrated medicine practice. My journey had, it was definitely a roller coaster ride, but somehow I managed keeping my blood sugars in level with the help of Swami Dayadhipananda Maharaj ji from Ramakrishna Mission. I've learned a lot of things. They also encouraged me to go for yoga and exercise, so I started doing that too. So I have noticed that my insulin requirement, total insulin requirement, has reduced from 60 to 50 after including exercise in my routine. So that was also kind of happiness for me, that yes, my insulin requirement is decreasing.
Good evening, sir. I am Ujjwal Singh and I hail from Dehradun. I am 19 years old and I am currently pursuing Bachelor's in Business Administration from Dehradun itself. And I am diabetic from past 10 years. I went to Ramakrishna Mission Hospital under the mentorship of Swami Dayadhipananda. I was told different aspects, or I would say different approaches of how to see diabetes as a positive quality inside you. I learned that discipline can be learned with diabetes.
मेरा नाम मयंक है, मैं हरिद्वार से बिलोंग करता हूँ और मुझे लास्ट 15 ईयर से टाइप 1 डायबिटीज़ है और मैं फाइनेंशियल सेक्टर में जॉब करता हूँ। मुझे एक्चुअली टाइप 1 डायबिटीज़ हुई थी 2005 में, जब मैं 15 इयर्स का था।
अच्छा।
और उस टाइम मैं 9th क्लास में था, तब मुझे टाइप 1 डायबिटीज़ हुई थी। और मैं यहाँ पर रामकृष्ण मिशन हॉस्पिटल में मैं आया 6 इयर्स लेट, 6 साल के बाद में आया। लेकिन वहाँ से ही एक मेरा जो एक प्रॉपर एक जो ट्रीटमेंट मिलना स्टार्ट हुआ, वो वहाँ से ही स्टार्ट हुआ। हम लोगों की जो लाइफ है वो रामकृष्ण मिशन हॉस्पिटल में आने के बाद इसलिए बदली है क्योंकि यहाँ पर हमें ट्रीटमेंट जो है, जो एक इंसुलिन है, वो तो ओवरऑल हम कहीं पर भी जाते वहाँ पर भी इसका ट्रीटमेंट इंसुलिन ही था। लेकिन यहाँ पर एक जो डिफरेंस चीज़ है वो ये है कि यहाँ पर हर बच्चे को एजुकेट किया जाता है, हर एक बच्चे की काउंसलिंग की जाती है, बच्चे के साथ साथ उसके पेरेंट्स की भी काउंसलिंग की जाती है। जो सर हैं, डॉक्टर साहब हैं, जो स्टाफ है, नर्सिंग मैम हैं, जो वहाँ पर जो इन्होंने एक डेडिकेटेड एक मैम हमें डेडिकेट की हुई है कि ये आपको गाइड करेंगे, ये आपको काउंसिल करेंगे, ये आपको एजुकेट करेंगे। तो ये एक बहुत अच्छी बात है।
Thank you all for sharing your experience. It's always inspiring to listen to these children who have actually learned the diabetes management, learned the physical implications, and then integrated their physical health with their mental, emotional, intellectual, and spiritual health, and have elevated their creativity to the level that they are doing such wonderful work and going along and studying. Beautiful, inspiring. Next, I would like to introduce Swami Dayadhipananda ji, also known as Dr. Shiv Kumar, who is an MBBS doctor from Karnataka, who later on went ahead and took sannyas from Ramakrishna order and is a monk and a Swami of Ramakrishna order. It gives me personal joy to introduce him. I've been so much benefited from my association with him for the past 5 years. He is a God's man doing God's work, a real Karma yogi. And I spent a month with him recently and learned yoga, dhyana, pranayama from him and all the nuances of the integrative medicine, which I'm practicing in my own life. So without further ado, I would like to introduce and have Dr. Shiv Kumar Swami Dayadhipananda to present to us his point of view on type 1 diabetes management. Swamiji.
Namaskar, a warm good evening to all. Respected Dr. Sushil Sharmaji, my honorary consultants, eminent endocrinologists, research workers in the field of diabetes, Dr. Pratik Chaudhary, Dr. Ravi, Dr. Srikanta, my special thanks to the organizers of AAYM, especially the members and the program coordinator Anjali, who has put up a lot of efforts to have this platform in which we can share few things which will be useful to all when it comes to management of diabetes. Now, I take you all to the PowerPoint presentation through which we shall learn few basic things about management of diabetes. So my topic for today's discussion is role of yoga in diabetes mellitus. This is the place where I am privileged to work, Ramakrishna Mission Sevashrama, Haridwar, located in the northern part of India. This hospital was started in the year 1901 at the behest of Swami Vivekananda by his direct disciple Swami Kalyanananda. We have 24/7 emergency ICU and a full-fledged hospital where we have got all the full-time consultants living in the campus and serving the poor and needy. This is a special picture which you are all seeing. Children with type 1 diabetes celebrating their so-called disease or a lifelong disorder. These are the unique moments for me wherein I see my children on the platform during the celebration of World Diabetes Day, where they perform colorful programs on the stage in front of all the dignitaries once in a year in our Ramakrishna Mission Sevashrama premises. Dear friends, as we know, diabetes is a chronic, preventable lifestyle disorder characterized by increased blood sugars. When it comes to types, we know type 1 diabetes, type 2 diabetes, gestational diabetes, secondary diabetes due to other diseases of the pancreas. Today, I'll try to focus on the type 1 diabetes. So when we talk about the common causes of diabetes, why the blood sugars are going up, many of the times we can get an answer. Yes, these are preventable, but there are some lifestyle disorders like physical inactivity, because of which we get central obesity, and the common stress that everybody is facing today may lead to diabetes, and that's a preventable cause. So what happens in diabetes? Why the blood sugars go up? Because of the insulin resistance. Now, can diabetes be controlled with yoga, exercise? Yes. To understand this, first of all, we should understand there is a body-mind connection. And we are not just this body and mind, but there is soul or spirit, the highest energy, which can neither be created nor destroyed. That universal energy which runs the whole universe also runs our body and mind. So when you understand there is something behind this body, we get to know few more things. The gross body which we are seeing outside, which is made up of the food that I eat. I am Swami Dayadhipananda. I have got a form and name. The external form, what you are seeing, that is called as Annamaya Kosha, the physical body. And energy required to run this body is called as the vital energy. So that is called as Pranamaya Kosha. Yes, I have got a body and there is some energy, vital energy, which runs this body, but there is something behind it which makes me to function. For example, I have got my hand. If you give a knife in this hand, that knife can be used either for cutting somebody's neck and harming him, or doing a surgery to save a life of a person who comes in our emergency. So what is that which makes to do sometimes good, sometimes bad? That is our mind behind this body and prana shakti, that is manomaya kosha. Once my mind is trained with right thinking, right living, my mind gets proper directions. The trained mind, which is having a capacity to think definitively, that is called as Vijnanamaya Kosha. And behind this, that energy, highest energy, universal energy, which runs everything, because of that, all these layers, all these, what I talk, Annamaya, Pranamaya, Manomaya, Vijnanamaya Kosha running is the Anandamaya Kosha. Ananda, the bliss, the eternal joy comes out of our real nature, that is soul, spirit. If you are a believer of God, God himself is running this body. So when we understand this body, what we are seeing externally, and the diseases which are seen in this physical body also has some higher dimensions. So when we understand, then we really understand the role of integrated medicine. So when we understand, we are not this physical body and mind, Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha, we also need to attend all these. Then only we feel better. That's what integrated medicine means. And WHO also says, World Health Organization, physical, mental, social, and spiritual well-being of a person, and not just free from disease. So when we understand the definition of WHO, when we understand the 5 layers which is running this body and our body whole in a whole nutshell, then we understand when we want to address anybody for wellness, he should be addressed for Annamaya Kosha. To keep this physical body fit, one needs to do proper physical exercise, asanas, and some exercises. And to take care of the Pranamaya Kosha, which runs this body, that vital energy, we need to learn to breathe properly. That is learned through pranayamas. And by doing proper meditation, relaxation techniques, our mind gets trained. That mind which runs this, which makes this body to function. So that mind gets trained by meditation and breathing, relaxing exercises. So when we talk about Jnanamaya Kosha, which directs this Manomaya Kosha to function in a proper way, we should take help of scriptures like Upanishads, Bhagavad Gita, and all great religious teachers. That will help us to develop our Vijnanamaya Kosha. Anandamaya Kosha, which is our real nature, that can be reached by practicing Karma Yoga, doing the work in the spirit of service, by doing good to others. That is called as Karma Yoga. Also, it can be attained by proper meditation when one reaches the state of Samadhi. So this is in brief about the different layers of our body, the layers which are behind or beyond this physical body. So when I talk about type 1 diabetes, as we all know, type 1 diabetes is an autoimmune disorder due to which our body has failed to produce insulin. So as a practicing allopathic doctor, I teach my diabetic children how to manage their blood sugars, how to take insulin according to food that they eat, how to take care of their physical, mental, social, emotional, and spiritual well-being. That's where role of yoga comes, especially in the management of type 1 diabetes. It's very unique. In the journey of 10 years at Ramakrishna Mission Haridwar, with the help of eminent doctors from India and outside India, we have developed a module by which more than 300 type 1 diabetic children are leading a healthy and happy life. So, yoga and pranayama, as I said, benefit anybody immensely for a healthy life, for being wealthy and being well. So what are these yogasanas and how they are going to help us? As I said, obesity is a very high risk for somebody to develop diabetes. And these type 1 diabetes children, if they develop obesity, they can have added complications. So yogasanas help in reducing the obesity, thereby decreasing insulin resistance. So to name few yogasanas and pranayamas which can be practiced by everybody and especially type 1 diabetic children and any other diabetic patient are Bhastrika, Kapalbhati, Anulom Vilom, Brahmri, Udgita, Surya Namaskara, Tadasana, Trikonasana, Paschimottasana, Bhujangasana, Shavasana. So these are the few postures which can be learned from your yoga experts who is available with you. These are my type 1 diabetic children who are very well versed to take care of their blood sugars because they get proper DSME, diabetes self-management education. Along with that, we conduct monthly support group meeting in which the children, parents are taught about diabetes by expert speakers online, by local eminent people, by doing counseling. So like that, with that effort which is done by all, these children are performing This girl is Vishika. When she came to me, she was 3-year-old. Now she is 10-year-old. She has become a yoga expert. We also conduct support group meeting and summer camps where we teach them yogasana and pranayama. What does pranayama does? As I said, pranayama helps in regulating the breathing pattern, thereby relieving the stress. So in the beginning, when I introduced stress, and if you don't know how to breathe properly, your vital energy is not being functioning properly, thereby you become a high risk candidate to develop metabolic disorders, autoimmune disorders. So why pranayama has immense benefit by practicing pranayama, our vital energy is properly distributed and we are stress free. So pranayama like anulom vilom, kapalbhati. So anulom vilom, we can see breathe in through left nostril, breathe out through right nostril. Breathe in through right nostril and breathe out through left nostril. By doing this, our breathing is balanced. So when there is equilibrium between body and mind, we are stress free. When we are stress free, our hormones are in order and there is less chance of getting metabolic disorders and less chance of getting autoimmune disorders. So if one can practice the principles of treatment as taught by our own system, along with that, meditation, prayer, and yoga, we have immense health benefits. What I recommend is the treating doctor should also practice yogasana, pranayama, prayer, and meditation along with the children, especially in the support group meeting. Ramakrishna Mission Haridwar conducts every month support group meeting last Sunday, and for the last 10 years, not even a single month it has gone where we have not conducted support group meeting. Spiritual strength helps us to overcome hardships. We can take healthy decisions which are good for me and for others. That helps in to live longer. Studies have shown all these. Also, our scriptures have taught, as Bhagavad Gita, Sri Krishna teaches, even a little bit of spirituality saves one from great dangers. So, if you practice even little, we get immense benefits. The message of Swami Vivekananda, strength is life, weakness is death. So, we should learn how to become physically, mentally, socially, emotionally, and spiritually strong so that we lead a happy life by becoming fit, by being fit, healthy. What we do help others. Once I become a good person, I can help others to become good. That's what be and make. There are few pictures of the support group meeting where eminent people come and participate in our support group meeting. So with this, I thank one and all for your patient listening.
Thank you, Swamiji. That was a beautiful presentation. And being a student of science, you're a doctor, allopathic MBBS. You combine and integrate the best of the East with the best of the West. And you've created this beautiful model for treating these diabetes children. Thank you. And now I'll invite Surbhi to share her experience with us.
Namaskar, good evening everyone. Myself Swami Chaudhary. I'm 24 years old and I'm type 1 diabetic for the last 14 years. So when I got diagnosed with diabetes, at that time there was not awareness about type 1 diabetes. Only my parents were aware about type 2 diabetes. They didn't know that a child can also get diabetes. So at that time, by luck, I can say I got diagnosed with diabetes and I got admitted to Ramakrishna Mission Haridwar. Over there, I got to know all the things about diabetes. That this is just a condition in which we just have to take insulin from outside. Rest, we are very much healthy. So at that time, I personally want to share something with you all that I had an inhibition to not to tell everyone about diabetes, that I'm a diabetic. I feel very shy. I feel very worried about it, that if I tell everyone about diabetes, then what will they say? So I just used to visit my doctor, take medicines, and come back to my home. So that was the only thing I was following. So slowly and gradually, I can say, uh, I got to know, I realized that it was not enough. What am I doing with my life? So I realized that I need a family, I need a support, I need emotional support, I need to meet others like me who can help me out in my journey. So at that time, Maharaji told me that I'm not alone, there are many others like me. So I started going to the support group meetings. So I used to sit on the back seat and used to watch all the things which are going on. Then slowly, with the help of Maharaj I started leading the meetings which you organize every month. So now I can say that I'm not afraid of diabetes at all. With proper knowledge which I have got from Ramakrishna Mission, I feel very proud of myself that I'm a diabetic. I can proudly say that yes, I've got diabetes, and it's a really good thing. So the support which I have got from Ramakrishna Mission, so I wanted to give that to others also. So I started serving others also, serving mankind, I can say. So all the things which I've learned from Ramakrishna Mission, I started sharing with my friends, with others who have type 1 diabetes. So at that time when I was diagnosed, my family was very much in shock, but they supported me a lot. And support is the foremost thing that is needed by a child who has recently got diagnosed with diabetes. So now I'm very much inspired to share my journey with everyone. And I don't feel that I'm doing anything bad in my life. I'm doing really good with diabetes. So like if I share something with others, so I feel like it may help many children like me who feel alone because of diabetes. So if one wants to live happily with diabetes, then they should not hide themselves, they should think positively in every aspect. So by taking proper treatment and by taking proper knowledge, one can do wonderful work with diabetes. So for me, type 1 diabetes is blessing in disguise. I've got a lot of friends just because of diabetes. I've got to meet wonderful people like you. So I've got a family who support me in every ups and downs, and I do feel very proud of that. Along with my studies, I help my mother. I help others who are diabetic also. So I do follow a healthy routine, and because of yoga and exercise, which I started following, my total insulin requirement has came down to 50 from 60. And then after some time, I started bringing slight changes to my diet. And because of those changes, now my total insulin requirement has reduced to 20. And it's a really good thing, and I feel very good that I'm doing something good with my life. My insulin requirement is reducing. So everyone can do that if they follow a healthy routine. Uh, if they set a goal, then they will definitely have success. So I would like to give everyone a message that if you are a diabetic, if your child is diagnosed with diabetes, so help them to come out of this trauma. You don't need to show them that they have got something in their life, because of that they will not be able to do anything in their life. You just need to support them, and that support can do wonders. So my message for all is, if you want to live a healthy life, then tie it to a goal, not to people or things. Then you will be able to live a very happy life with anything which you have in your life. Just feel proud of that. Thank you so much.
Thank you, Surbhi. Thank you for sharing your personal story. It was very inspiring, and you're a true champion and a role model for many generations and people to follow. I'm grateful that you came and shared your experience. Thank you.
Thank you so much.
It gives me great honor to introduce our next speaker, Dr. Srikanta, he is a remarkable gentleman who is actually the starter and originator of Samatvan Disha. He's a senior consultant endocrinologist. He did his MD in endocrinology from All India Institute of Medical Sciences, and then moved to a prestigious Duke University in America, where he did his endocrinology fellowship from. And then he went ahead and became an investigator fellow at Harvard's world-renowned Joslin Diabetes Center, and he was there until 1982. And then, out of the goodness of his heart and his love and service for his country, he decided to come back to India and serve India. And for all the good work that he did in 2018, he got Dr. B.C. Roy Award for selfless, outstanding lifetime service and contribution to mankind. He has started the Samatva model, and without further delay, I would have Dr. Srikanta share his experience with us and give us the joy of listening to his good work.
Namaste. Anjali, I have to share the screen. Okay. Shri Siyaram, Shri Siyaram, Shri Om, Shri Om, Shri Om, Shri Om, Shri Siyaram, Shri Siyaram. Respected teachers, friends, and the young ones, greetings from Samatvam Gnanasanjivani, Bangalore, India. Sadashiva Samarambam, Shankaracharya Madhyamam, Asmadacharya Paryantam, Vande Guru Paramparam. I thank all the organizers and Swami Dayadhipananda for this unique learning opportunity. Let me submit my reverence to Guru Maharaj Sri Ramakrishna Paramahamsa, the Holy Mother, and Swami Vivekananda. To Swami Sarvagatananda, the monk of the Harvard MIT Vedanta Society, for giving me meaning and purpose in life. He taught us to give more than we take. My pranams to Swami Asheshanandaji Maharaj, who told all his disciples, do not be a creeper, be a tree. As a doctor and a scientist and a human being, and all of us, we talk about science, medicine, and immortality. And we have to question, in the scheme of things, where is God? To share the words of Dr. Albert Einstein, he commented, science without religion is lame, religion without science is blind. If you walk into the portals of MIT in Boston, this inscription welcomes you at the gate. Dr. Yallapragada Subbarao, one of the foremost physician scientists of India and America, who spent later part in America, who deserved a couple Nobel Prizes from chemotherapy to ATP, etc. He tells us science simply prolongs life, religion deepens it. More recently, Professor NVC Swami, former director of IIT Madras, tells his students, have your feet firmly grounded in spirituality, hold your head high in science. After retiring from IIT, NVC Swami spent rest of his life teaching Bhagavad Gita and the message of Sri Vivekananda. When we talk of science, it is physical science and spiritual science. I have compiled to you two stories. The first story is about the beta cells and the artificial pancreas, the story of Jamie Kursi, Dr. Rehan Lal, and the stars of India. I am sure Pratik, who is an expert in this, will enlighten you more. Coming to the spiritual science, let me share with you more than 30 years journey of Camp's Man Mohan, most endearing, and the dream of an equal society, and Sri Basavanna, the saint philosopher of Karnataka. First, the story of beta cells, artificial pancreas, and Jamie. All of us know one of the most wonderful cells most smart cells God has ever created are the beta cells of the islets of Langerhans. In simple words, the beta cells is a very intricate machinery consisting of the glucose sensor, as shown on the left side of the diagram, the insulin factory, as shown on the right side. In between, there is a complex set of coordinated metabolic reactions, ion channels, etc., which I call it as the beta cell brain. The end result is perfect minute to minute, second to second glucose homeostasis, insulin secretion. As Swamiji mentioned, we have realized for more than half a century that unfortunately in type 1 diabetes, for no fault of their own, the islet beta cells of these young children get destroyed by an autoimmune mechanism, and one of the hallmarks being these antibodies to the islets in the blood. This associated with inflammation, insulitis of the islets, and progressive slow destruction of all the beta cells to complete insulin deficiency. Many may not know that this discovery of autoimmune beta cell destruction and pre-type 1 diabetes, that type 1 is not an acute disease, slow disease, originated in All India Institute of Medical Sciences, New Delhi, traveled to Durham and Boston, where it culminated. These are my two revered Gurudevs. As early as 1983, when the discovery of pre-type 1 diabetes was done, we along with others dreamt whether this disease can be nipped in the bud, where the autoimmune destruction can be halted right at its origins. The dream at that time, and it continues, is antigen-specific vaccination with beta cell antigens for prevention of type 1 diabetes using the Nobel Prize-winning technique of monoclonal antibodies. But the dream has thus far not been fully realized throughout the world. Despite this, most people in the field know that currently there are more than 500 treatment strategies by which you can completely prevent or cure type 1 diabetes in the mouse model called NOD mouse. We hope that one day soon this research will be translated and that type 1 diabetes will be eradicated like polio. Till the time, you all know that insulin replacement therapy by any form is the life-saving. In simple terms, any form of insulin replacement therapy, the patient, the doctor, and the insulin pump have to think and behave like the pancreas made by Lord Almighty. We have the open loop insulin pumps, the sensor augmented open loops, and finally the complete closed loop referred to as the artificial pancreas. It is an engineering replica of the God's beta cell, where a continuous glucose sensor talks to the insulin pump using a software known as control algorithm and try to maintain near normal glucose homeostasis. Several forms of artificial pancreas are a reality. In addition to the engineering solution, a biological solution which has promise in the future is artificial beta cells. To generate artificial beta cells, either from stem cells or transdifferentiation from acinar or liver cells, we hope this has succeeded in animal models, hope the dream will be true for humans. Still, even the new beta cells have to be protected by immunoisolation from recurrent attack by the body's immune system. Now coming to the Jamie story. We received an email at 1 a.m. on September 20, 2019 from a young 15-year-old girl from California called Jamie, which had laid the foundation of Atmanirbhar Bharat and Self-Reliant India. Jamie and father runs a software company and has a branch in Bangalore. They decided to end 6 months early this year, and they Googled us and our work and came. Jamie got diabetes at the age of 1. And now she's a 15, a student at Stanford. And the dream of their family is to make a low-cost, economical, make in India artificial pancreas in Bangalore for the whole world. And how did Jamie and family, they're pursuing this dream. This is Jamie's doctor from Stanford. He's another noble soul called Rehan Lal. Rehan Lal got type 1 diabetes as a youngster, and he went on to Berkeley, became an electrical engineer with the hope of finding an engineering cure for diabetes. But as he was doing his engineering, his 12-year-old sister also developed type 1 diabetes. This further motivated him, and then he joined medical school, became an endocrinologist, and now he's one of the world authorities on artificial pancreas. He uses the same. He is Jamie's doctor. And Jamie and Rehan have started the Indian dream. Jamie spent several months in Bangalore with our center. The end result, on March 12, 2020, 6 of our Indian children got initiated in the artificial pancreas, and Rehan Lal considers this is the most rapid transcontinental artificial pancreas program ever implemented. You can see several of the Indians are the scientists here, and it took a lot of groundwork. Entirely the generosity and all the material generated from US. It's an open Android APS. This is young Jamie with her family at Samatvam. One example, this is young Siji, who uses insulin pump for several years. She's a biotech engineer. Despite this, before going on the artificial pancreas, as seen on the red, her hypoglycemic episodes were from 10 to 70% below the range, and time within the range was only 20 to 50% with extreme glucose variability. This is how they started their artificial pancreas. Many of you may not be familiar. The green line shows near perfect glucose control in the range of 80 to 160. Within 7 days of the artificial pancreas, her time in range jumped to 91% and time below the range only to 1%. And this persisted. All this is fine. It's time for me to move to the other story about the human spirit. We all know that insulin is life-saving and has saved millions and millions and continues. But there is another very equally important life-saving medicine which you need to call as love and care. How to deliver it? The person sitting here is Professor Ahuja. When I returned on October 3rd, 87, the first assignment he gave me was gifted me with 500 type 1 children at the All India Institute of Medical Sciences, and thus began the series of camps known as Camp Manmohan, after Professor Manmohan Singh Ahuja, the father of Indian endocrinology diabetes. He was trained in Mass General and Hammersmith. The journey continued. The poorest of the poor, they shared their lives. And this is the last one, 2019. About 100 children traveled along with about 30 medical people to a remote village in Karnataka, 250 kilometers from Bangalore, blessed by the revered medical scientists and the spiritual scientists. Just a glimpse of the heaven on earth, the health education, medical care, bringing smiles on their face, personality development, cultural enrichment, children from all castes and religions. Every time we do a program, we realize it is not that we, the health professionals, who are helping these children. It is they who give us infinite, unconditional love and care and share and make us better human beings. Let me end with a most inspiring story of Spurti. Spurti is 14 years young, and she comes from a village called Arsikere near Bangalore. She is now 14. At the age of 9, when she developed type 1 diabetes, the family was surrounded with hopelessness and helplessness running from hospitals with comas and this. The family went into a pact, a suicide pact to kill all themselves, entire family. The young 9-year-old Spurti told their parents, don't, let us not do it. I'll bring pride to you. 2 years ago, Spurti won a global art contest for her 2-minute inspirational video called Children with Diabetes, Future Stars. It's on YouTube, if time we permit. So we collected money. Spurti went to United Nations in New York along with her father, and now she received the award, and she hopes to become a doctor, and that too a pediatric endocrinologist. Let me conclude. Yes, insulin is life-saving. So is love and care. As Swamiji has told, science and spirituality have to be integrated and synthesized in every aspect of life, including human health. And that too also specifically for these innocent children. May the type 1 children all over the world be blessed. Thank you very much. Hari Om. Thanks for the learning opportunity. Thank you all.
Thank you, Dr. Srikant. That was a beautiful journey that you took us through pathophysiology and through science. And I also was very moved to see how beautifully you combine knowledge and wisdom and also a bit of philosophy. And you yourself are a role model and an inspiration, and doing such great work. It was heartfelt. Thank you. Thank you for sharing with us. It gives me great joy to introduce our next speaker. It's Dr. Pratik Chaudhary. Dr. Chaudhary is a professor and a consultant endocrinologist at Leicester Diabetes Clinic, University of Leicester in England. He is confined only to treating type 1 diabetes, so he's a highly specialized person. He had his MD subject as continuous glucose monitoring, and he spent 15 years at King's College London training. And he's also the co-lead of UK insulin pump project. And he brings a unique confluence of education, psychology, and technology in the field of type 1 diabetes. So I'm delighted to introduce Dr. Chaudhary, and wait to listen to his beautiful words of wisdom. Dr. Chaudhary.
Thank you, Namaskar. And I just hope get my slides over. So I think it's very hard to follow those 3 talks, Swamiji, with the introduction on yoga, Surabhi, with that really personal story of diabetes and how it affects people, and of course Srikantaji with that beautiful interplay of science and religion. So what I oops, Anjali, do I have to do anything to share the screen or my slides? Thank you. Is it sorry, I'll just there we go. So it was my pleasure and privilege really to visit the hospital in Haridwar with years ago, and meet the Dia champs really out there. And the thing that struck me when I met them is I've worked for 50 years in one type 1 clinics in the world at King's, and we have access to pumps and sensors and all the technology and all the latest gadgets and things. But when we asked these people in the room what their glucose levels or what their control was, it was better than the control of the people we see who have access to everything. And when you looked at the faces and how they're interacting with their diabetes, how they're coping with their diabetes, what their identity is with their diabetes, again, it was much stronger. They were much happier than a lot of the people I see. And I think it's not due to anything else but the love and kindness of Swamiji and the way he's built this community of people together. And I saw this poster made by a class 5th girl, Kashish Chaudhary, boy, class 5th child, and it really touched my heart, because you've got the story of the child who is labeled as someone with type 1 diabetes, someone who's different. Maybe the children are playing and nahi hum tumko apne sath nahi khelne denge, tumko diabetes hai, and it just highlights what this little child was feeling about how the diabetes had affected them. And I slide of people, and what it shows that even the person might have a calm exterior. If they have diabetes, there's so many things going on in there. What they eat, did they have the right insulin, what's their blood sugar, what's going to happen in the long term. If they meet someone, what will that, as Surbi said, what will the other person's reaction be? That this person has diabetes, will I get a job, will I get married? There are so many things that go on that mind that really have a big impact. And it's not surprising actually that so in literature we calling this distress, and the distress, upset, all the things you have to do. You have to prick your finger, you have to insulin, you have to think of your food, do your exercise. Now, of course, all of us have anxiety in other areas as well. It might be financial anxiety, social anxiety, what's going to happen with my job, what's going to happen with my education, what's going to happen with my relationships with other people. And these things can layer over. And when you have other things going not so well in your life, maybe the push comes onto the diabetes. That can lead to depression. And we know that people with diabetes are about 4 or 5 times more likely than the background population to feel depressed, often because of all these things that are going along. And so whenever we see this, one of this story of integrated approach is firstly recognizing that there are people who we look after with type 1 diabetes. These are more common. And instead of just chasing down your blood sugar level, did you injection, did you check your glucose on your finger, looking at their mental health, looking at the emotional health, and having strategies in place to help that is really important. Because it could be the person is upset because they have got high HbA1c, sugar control is not good, and they don't know how to get it right. And that is a lack of education, of teams, that is a lack of maybe the tools, the equipment, the strength. Maybe they have got, after having diabetes for a long time, I see a lot of people with 30, 40, 50 years of type 1 diabetes. And they say, every day I want a couple of days off when I don't have to do all these things. Or people who are still not accepting, I want to pretend I don't have diabetes. And on the other hand, you have, as I said, people have things happening in work or at school. And when that goes wrong and your mood is down, then you don't want to do the things, you don't want to do the diabetes care that you normally do. And then there's this constant fear of weight gain, fear of complications, fear of failure, fear of not getting all the sugars right. All these things play in the mind. And so that's where there's a real space and role, and not just in centers dedicated to yoga like the Ramakrishna Mission, but also here in the West, that how can we address this mental unease that happens with diabetes? We calm this down, because it's important to treat that mental health, and if that has some beneficial effects on the physical health, that is a bonus actually. And so you talk about integrating mind and body, and so in simple words, you've got the person with the is in the middle. It's as people who give diabetes care and are responsible positions nationally in the UK, we have to make sure that every child, every person who lives with type 1 diabetes has access to the right education, how to use the insulin, how to carbohydrate count, how to adjust the insulin for their food, for their work, for their exercise, so they can do whatever they want to do to the full of their ability. I have patients who are professional football players, professional rugby players, people who are doing shift work, people who are doing heavy manual labor, people who are sportsmen doing athletics, and it's the role of the doctor to have enough knowledge that they can give to the patient without education. That perfect care team who wraps around the patient, not just looking at the sugars, but also looking at the emotional health. And the top side there, you also need to be able to provide equipment. It's not having someone who wants to do well, but then doesn't have access to the strips and access to the technology. And it was lovely to see the project in Bangalore around automated pancreas project. But the reality is, even in the UK, access to that sort of technology is limited by cost. Its cost is about 5 lakh rupees a year, and really even in the UK, in the healthcare system, people can't afford that, because you still need the pump and the sensor to run that algorithm. And then finally, of course, you need to have that way when the mind is a bit upset. How can you calm it down, bring things together? Because if the mind is, as we say in Hindi, vichalit, upset, then you can't use the education properly. You can't access your team properly. You can't use your technology properly. So having a calm mind, balanced mind, is a key to make use of all. And that's, I think, what we all mean by that integrated approach to diabetes, bringing together the best of education, technology, and psychology to help our patients. So I had a small message. Thank you so much for the opportunity to speak to you. I'll be very happy to answer questions towards the end of the panel. Thank you.
Thank you, Dr. Chaudhary. That was a beautiful exposition of the knowledge, the psychology, and the technology. And also, it was really great to see how you explored the pancreas and the mind connection, and how by actually controlling the mind, you also, to some extent, control diabetes, and the complications, especially in the mind, go beyond blood sugar and insulin. And therefore, something for the mind, such as yoga, dhyana, pranayama, all those exercises can be very beneficial. That was great. And I look forward to further comments from you during a question and answer. So now I have the honor and privilege of introducing our last speaker, but not the least, Dr. Ravi Kant. He is the president of Cardio-Diabetic Society. He is the secretary of Southeast Asia Diabetic Foundation. He is also the joint secretary of Uttarakhand Association of Physicians of India. He is chairperson, and he's also a full professor at Department Research Committee at All India Institute of Medical Sciences. And he's also a published author. He has written a book, I and My Diabetes, and he's also written a book, Updates on Alcoholism and Alcohol-Related Diseases. And would love to hear what Dr. Ravi Kant has to say about the management of diabetes. Dr. Ravi Kant.
Yeah, thank you very much, Dr. Sushil, and it's really a privilege to be amongst you. Am I audible to all you?
Yes.
Right. I'm trying to fix my slides because this platform is quite new to me. I'm not. My slides visible to you? Yeah, are they visible now? Yes, 1 minute, 1 minute. Slides are visible to all you? I'm not able to see them. Yeah. Yeah, are my slides visible to all of you?
Yes. You can.
Yeah. So let us move ahead with the, yeah. So let us move ahead with the, I must say thanks to Swami Dayadhipananda, and with whom I am associated for almost 2 years or so, and really glad and happy to see his work and the magical changes that he has brought about in Taiwan diabetes management. So this is just a sensitizing session. To begin with, I'll post certain pictures in front of you. So these are certain pictures. Are my pictures moving? Yeah, I'm not able to see it on my screen. Yeah. So these are the pictures of certain food items that we love very much. They are quite tasty, and we want them to be on our dining table every time that we eat our food, maybe lunch or dinner. And some Indian traditional food, some sweets, as well as many more items. Yeah. So go about the integrated management of type 1 diabetes. Much has already been said about, and we already know that a human being consists of mind, body, and soul. Regarding soul, Swamiji has already told, and much has been said about dhyana, pranayama, and many more postures that take care of, in a sense, especially by pranayam and other postures. Now, let us talk about the body, which is the physical form, and how to take care of the body. Uh, Let me take you through certain hard facts about managing diabetes and managing, other chronic illnesses like cardiac disease and so on. Let me put forward a Finnish diabetes prevention study wherein we included 522 middle-aged, overweight persons with impaired glucose tolerance. It was randomized to brief diet and exercise counseling or intensive individualized instructions. Goal was to reduce 5% of the body weight and
Hello.
saturated fatty acid less than 10%. Yes, hello. Yeah, less than 10% energy, and should be fat less than 30% of total energy intake. With fibers, of course, more than 15 grams per 1000 kilocalories, and physical activity more than 150 minutes weekly. This is a standard regime that we prescribe to most of our diabetic patients to follow. Now, let us see what this structured program brought about in this Finnish diabetes prevention study.
Dr.
Now we
Ravikant,
see, yeah,
Dr.
yeah, am I,
Could you
yes,
put
yes,
it in full screen mode so that we can see the whole screen? We're not
yeah,
seeing the whole screen.
sure. Yeah, is it visible now?
No, no. See that a screen. Yeah, here you go. Thank you. Thank you.
Yeah. So what do we see in this Finnish diabetes prevention study? That the patients, yeah, after 4 years, the risk of diabetes was reduced by 58%. So this is the benefit of treating the metabolic syndrome. And to share with you a very interesting fact that we have recently concluded our ICMR study in the rural population of India. We included area like Rishikesh and approximately 12 other districts in Uttarakhand, totally hilly and rural areas where we feel there is hardly any infiltration of fast food and these fried items. So we analyzed the traditional Indian food consisting of these samosas, jalebi, pakodi, and traditional Indian food that we love very much. And to the utmost surprise that we can see that the prevalence of metabolic syndrome is approximately 25 to 40%, varying from place to place. And there is a high prevalence of dyslipidemia in rural Indian population, who we say that hardly they are dependent on fast food. But I must share the idea that fast food may be fast food for a country, but maybe traditional for some other countries. So, for example, these samosas, jalebis, and pakoras, they are quite common in India. They are considered as traditional Indian food, but they are equally harmful. The food that contains most of salt, sugar, and fat, they of course are very dangerous. So we have screened school students as well. Now to go about the dietary component and how to fix the problem of metabolic syndrome and dyslipidemia, and thereby reducing the diabetes type 2, and specifically how to take care of type 1 diabetic patients by natural means. So these are certain molecules which are really found useful in managing lipid in basically diabetic population, and otherwise also they are seen to have a level 1 evidence or at least level 2A evidence in preventing the cardiovascular risk in various class of people. The promising molecule like berberine is a classical example, which is having a level 1A evidence and with a dose of 500 to 1500 milligram is supposed to reduce the LDL by 20% and has a direct vascular effect. It's not demonstrated, but still it has been seen to reduce a lot of parameters, including glucose and HOMA index and blood pressure in otherwise patients who are taking berberine. Similarly, the green tea extract is very, very useful, and soy and lipid proteins. If we talk about polyunsaturated fatty acid omega 3, their role has already been discussed in length and breadth, and they have been found to have direct vascular effect effect in cardiovascular biomarkers, and reduction in inflammatory markers in diabetic as well as non-diabetic population. Similarly, we have so many other food items with us, naturally occurring food items like oryzanol and so on. Similarly, spirulina and curcumin. Curcumin nowadays is a big way it has come. It has got so many properties, including anti-inflammatory property. It has got a a beta cell stimulating capacity. This has got a this has got an insulin sensitizing capacity, and many more arena of curcumin are being explored. So the concept of integrated management of type 1 diabetes is not a newer one, but the practice is, of course, a newer one. We can treat the patient with type 1 diabetes right from exercise point of view, along with natural food, exercise, yoga, and pranayama, because they have to live long and they have to pass their life with type 1 diabetes. So I believe that integrated management is the way ahead. So there are many more food items. I need not go into the details of each and every food item. If in some other forum we can share these really useful products for management of diabetic, both type 1 and type 2. Although their efficacy remains elusive and needs to be revealed in type 1 diabetics, but of course type 2 diabetes is well accepted, and this is an add-on therapy to type 2 diabetes. So I must share the rapidity at which the type 2 diabetes mellitus is increasing. Similarly, what we are finding, the changing lifestyle over a long period of time will, of course, lead to genetic changes, and we are bound to have a huge population with type 1 diabetes over a few decades, or maybe 3 or 4 decades later. Because today morning only, when we were conducting Southeast Asian Diabetes Foundation conference, 2 days conference webinar, it was well appreciated that Indian population is not, or Southeast similar population in the Western. There are so many aspects that we differ. The mean age of onset of diabetes in Indian setup is fourth decade or latest fifth decade, as opposed to sixth decade in Western population. Our insulin resistance is high per body weight, per kg body weight. We are different from Western population, and in so many aspects we are different. Now, I have an inactive lifestyle. I have a cholesterol, I have high blood pressure, I have high waist measurement, I have overweight, I have impaired glucose tolerance, I have heart disease, I have diabetes in my life. Many people in my community have diabetes. What this is doing basically, this is trying to have incorporated a permanent change in genes, because environmental factors over a long period of time do have a genetic change. A human being is a human being in India, same as China, same as US, same as UK. But why their colors are different? Why their hair are different? When we are same, it means the environmental aspects have got a lot of impact on genetic change on long-term basis. So we need to control all these factors by changing lifestyle, by being included more and more in the spirituality and yoga and pranayama. Now, what are the pillars for control of these, non-communicable diseases? So I must share with the primary prevention, which is a health promotion, and special protection. Now here lies the role of yoga, pranayama, and many more lifestyle changes like exercise and dietary management. Early diagnosis and prompt treatment as a secondary prevention, all we know. But our idea is why not to at the primary prevention level. But I'll go a step ahead, and I will advocate the primordial prevention. This primordial prevention has a relatively new concept. This is the prevention of development of risk factors themselves. So what I was talking about a few minutes back is really the same. So if we control the risk factors in our children today, so in near they'll succeed, they will see change in the prevalence of diabetes. It's very important to change the environment that promotes major risk factor development. So how to bring it? The education, education, and education. is the only key to this. So more and more the people are educated, diabetic, non-diabetic, and they have a primordial prevention concept in their mind. They can at least, stop the occurrence of new diabetes, as well as if it occurs, they can arrest it at the primary prevention level by specific protection and health promotion schemes and so on. So what is driving the diabetes epidemic over several well, overnutrition, crisis, obesity, almost 70% South African women are overweight, and we are not less than that. So can diabetes be prevented? Yes, type 1 diabetes cannot be prevented as of now, but the studies have come into picture that if a lady, pregnant lady, they're supplemented with adequate amount of vitamin D, the future generations would have low type 1 diabetes mellitus. This has been proven beyond doubt. So now, if we say, can diabetes type 1 be prevented? Yes, it can be prevented. It has been seen then those persons who are supplemented with vitamin D adequately in their adulthood, they develop less type 2 diabetes. So type 2 diabetes, of course, is preventable. Already we know that this is sort of a lifestyle disease, but yes, one tool we have got in the armamentarium of preventing the diabetes so far as type 2 is concerned. So yes, we are exercise, healthy eating, diet, and insulin, of course, type 1 and OH for type 2. I am not going in the detail. So here lies the holistic concept at the center of which lies the integrated management of diabetic population, which incorporates physical trainer or meditation, yoga expert, a balanced life, and healthy eating with lifestyle modification for better life. So these are all aspects of managing a diabetes. We all know. Yes. So the aim of management is to address the risk factors, meet the target. HbA1c should be kept well below 7%. We all know blood pressure management, lipid management, weight reduction, stop smoking, use of aspirin in type 2 diabetic patients and statins in type 2 diabetic patients specifically. So only when company if you want to have some snacks in between, but otherwise every calorie count and count. So counting your calories has got a lot of impact in managing diabetes, especially type 2 and nonetheless type 1, because children are crazy about eating and they have a way time to play less. That needs to be factored in while you are managing patients with type 1 diabetes. And it is equally important, as Swami has said, that the basic principles of yoga needs to be taught early in the childhood so as to have synergistic effect of so many organs. Say, for example, this Mayurasana is very, very promising in secretion of insulin, Mandukasana, and many more asanas because expert is there, Swamiji is there. I will not go into details of these asanas. But to the best of my knowledge, if a person is balanced through his actions, so far as mind is concerned by positive thinking, and soul is concerned by spirituality and pranayam, and so far as physics is concerned in the form of physical activity and exercise, and of course to take care as a fuel a balanced diet, mostly vegetarian, and to those who are not accepting vegetarian, fatty acid rich diet containing fish and other healthy foods is a cornerstone of managing diabetic epidemic, and hence we can not only prevent type 1 diabetes, but also we can take care of so many extra costs that are incurred in the hospitalization of these type 1 diabetic patients from time to time. And of course we like to have we will give a very fruitful, very energetic, very motivated, and a younger generation who is full of energy and positive attitude. I think I'll not go much into the detail of but for the slides. With this, I thank you all very much for giving me a platform to interact with you all. I hope it will go a long way. And recently, today only, I talked with Dr. Joseph, who has come up with a newer newer product. That's to say, it's a product that is bringing about a huge change that we even see with taken over 2 months of time or 3 months of time. This has already been published in ADA meetings, and hopefully, if we get a chance and time, next time I will introduce Dr. Joseph as well to showcase his work and to display what he can do, and will be a welcome move to include people like him who are really doing a real job, wonderful job through naturopath. With this, I thank Swamiji and his entire team for giving me an opportunity to be on this platform and interacting with you all. Thank you.
Thank you, Dr. Ravikant. That was a beautiful overview. May I request you to lower your camera so that we saw your head? We want to see your heart too, so whole body.
Oh,
Beautiful. And I really also enjoyed. Yeah, just lower the camera a little bit. We're only seeing upper part of your face. That's better.
Okay, but is it okay?
Yeah, better.
Yeah.
Yes.
Actually, this laptop is very new to me. I had I connectivity with my Mac, so
Thank you.
that's
Thank
why I
you.
had to use. Okay, I'm able to showcase what I wanted to. Thank you very much.
Thank you. I really enjoyed, you talked about primary and secondary prevention as well as the primordial prevention. So I'll come back to that. We're getting a lot of interest, a lot of questions. So my first question is to Dr. Pratik Chaudhary. We heard that type 1 diabetes is an autoimmune disorder. Some of the viewers would like to know if there's a genetic component, and also could you also briefly touch upon diabetes, type 1 diabetes, and impotence? Dr. Chaudhary.
Thank you. This is a very common question: is type genetic? But actually, less than 10% people with type 1 diabetes, any other person with type 1 is in their family. So most people will be the only person in their family who have type 1 diabetes. Whereas with type 2 diabetes, actually, it's, we all know it's so common in the families. So the genetic part of type 1 diabetes is that you have a higher risk. You have certain genes that put you at a higher risk. But if you have that gene, it doesn't mean that you're going to get type 1 diabetes. You can't predict when people, a lot of mothers are scared, will my child have type 1 diabetes? So the risk is about just less than 1 in 10. So if you have type 1 diabetes, for your child to get it, less than 1 in 10, and that could happen at any time in their life. So not when they're young, it could be when they're 5, 10. We're seeing an increase in type 1 diabetes diagnosed in the ages of 20 to 30, 35 even. While there's genetic component, I think a lot of it is random chance. Type 2 diabetes is much more genetically or family driven. If your parents have type 2 diabetes, you've got a very high risk of getting it. And the second point, Dr. Sushil, you asked me to cover is around impotency. And I think that's to the talking of separating the mental part and the emotional part with the diabetes. Because yes, of course, if you've had long-standing type 1 diabetes and have struggled to maintain the control, impotency is one of the long-term conditions. But actually, if you think about it, the mental side comes in much earlier, because if you don't have any of the other complications of type 1 diabetes, your feet are okay, you can feel things okay. And if someone is struggling with these sort of issues, it's probably more to do with the diabetes distress, the depression, the psychological impact of diabetes and how it affects them. And I think that is where becoming oneself, calming down, using mindfulness to could be helpful, because there is this in between the physical and the mental health. So I hope that answers the question.
Thank you very much. Dr. Ravikant, can you spend just 2 minutes and tell us about your concept of primordial prevention for diabetes?
Yeah, sir, please. Primordialization basically is the forward. For example, you are a patient with the CAD, stenting is not the option. Managing dyslipidemia is not the option as a secondary level prevention. Hypertension is not the option. This will recur again and again. What is required to prevent occurrence of the risk factors by early institution of healthy lifestyle right at childhood. So if we look the atherosclerosis or the pathologies even, you'll find that there is a lag of approximately 10 or 15 years or so before these diseases manifest. So regularly engaging the youngsters right from the age of 10 years, school going children, that the health education must incorporate a healthy lifestyle, or must say that medical education should be a big part in the schools. I am advocating it again, and I have talked to the speaker of this one, incorporate a subject, elementary maybe, right from class 3 or where people can understand, yes, it's a need of our to control your diet, to plate size. Say for example, as Indians, we serve the same amount of food, or we use the same mixtures that we're eating in, but their requirements are absolutely different. So it must be a muscular made plate for a child, where he must see himself that the amount of food served plate seems different from the size of the plate. So they will stop eating or overeating at least. Similarly, education, we can put positive health with teachers and the parents. Until unless we heavily incorporate the school education in
So,
the
sorry
risk
to hold you.
management,
Sorry to hold you up there,
disease
Dr.
prevention
Srikant.
will not
Your,
take
your
place.
audio is breaking.
Okay,
Your audio is breaking. I'll come back to you. Probably if you switch off your video, I think your audio will
am I
improve.
audible?
Yeah. So, Dr. Srikant, a question to you.
Yeah,
Please tell us about something in short about the availability and affordability of insulin pump and those technologies for children in India. And Dr. Pratik can chime in too also there.
Very important question. For the first time, we started the insulin pump program in 2002 in this country. We had the first insulin certified program from Medtronic. We had 5 trainers. The program started on the dining table of a young man with type 1 diabetes. He was a volunteer. And 3 of our trainers were type 1. But I'm still telling you, for several yes, it is expensive. It is beyond the reach of the common man. I tell people, if you can afford a Maruti car for your spouse or daughter, it's equivalent to that. It is expensive. And also, for some reason, the uptake of pump is not as good as it should be. And I put the blame on the medical fraternity. First, the doctors have to be comfortable about the pump. So there is a lot of discouragement. Don't worry. Now, the glucose sensors have become quite popular. And one more thing, even the pump companies have not been active. There are 3, 4 companies. Roche came and dropped out. So I think India is a large growing middle class. And I think if there is a concerted effort between the medical profession, the cost will come down. But I'm telling you, very soon, if God is kind, you will have a Make in India pump. A lot of good things, like
Great.
people like Pratik all over the world are helping. The interesting thing is, I'm getting requests from America to make a pump for America. I'll give an example. GE made an ultrasound for India, telling it is for a poor country. But now it is used all over the world. So we need a low technology, it'll happen. And do you know the artificial pancreas which RAN is promoted is all open source. We use a outdated Medtronic, and it is not a commercial one. It'll happen. Let us give our Prime Minister 2 to 3 years. That's
Thank
my
you very
guess.
much. Thank you. So now I've several questions from Swamiji, but you have, Swamiji, only 6 minutes in which you have to cover 3 questions for me. One question is, you can skip whichever one you want to skip, okay? The bolus insulin. The second question is the family support. The third is the group therapy. But there's also a very good request from somebody. If you can just share some asanas, yoga, and pranayama with us for 5 minutes. And before I give up, there's one question that just come in. Does mental stress during pregnancy in case of diabetic woman cause type 1 diabetes for her baby? The answer is no. Very good. So you can take in whichever order you want to take. It's all yours now, and you got 5 minutes to do the whole yoga, pranayama, dhyana, and change our lives.
Thank you very much. Herculean task, but it is possible. Abhi nahi to kabhi nahi. If it is possible now. Otherwise, never it's going to happen. So those who are all attending as panelists, dignitaries, and audience, I request everybody, yes, yoga should be way of life. योगा हमारा जीवन पद्धति होना चाहिए. कहाँ से? जहाँ हम सोते हैं वहाँ से लेके सुबह उठने तक. Early to bed, early to rise. Have a proper dinacharya. So what does that mean? If you follow this, your body and mind is at equilibrium. If you take proper rest in the night, you will be able to work throughout the day happily, joyfully. Your body and mind, if it is at equilibrium, no stress, you have got very less chance of getting disease. Your body and mind, if it is in ease form, you will not get disease. So it's as simple as that. So if you have a proper routine, then right kind of eating, right kind of living. What is all that is good food, as we have learned through various panelists? Fresh fruits and vegetables should be taken in abundance. And the cooked food, whatever we are eating, it should be out of unprocessed cereals. Again, the cereals, whatever I eat, also should contain sufficient amount of cooked vegetables. So, right way of eating and right kind of eating. Now coming to right kind of living. Yes, I should always try to understand the purpose of life. If I can be happy, people around me can be happy, then we can build a happy world. If you have this concept, if you train our mind, intellect in this direction, you will become better person. If your body and mind is nice, you will have less chances of getting any disease. Now coming to basal bolus concept in India. Yes, it is very much possible. We have taught to the illiterate, the poorest of the poorest children and parents, how to take basal bolus concept, insulin. For treating type 1 diabetes, to keep their blood sugars normal, to make them happy, to keep them healthy, basal bolus concept to separate insulin is a must. The children and family should be taught to how to do measure their blood sugars, maintain a proper blood sugar charting. It is very much possible. And role of parents and support group meeting is a must. If you ask me, if you want to have a healthy children and family, the parents and the support group meeting is a must. DSME, Diabetes Self-Management Education, along with yoga, can make them extraordinary children. What are few yogasana everybody should practice? Surya Namaskara, we call it as king of asanas. Before we practice Surya Namaskara, we should practice some free hand exercise, Sukshma Vyayam, so that all the joints will get relaxed. So free hand exercise, Sukshma Vyayamas, Surya Namaskaras, and as rightly mentioned by our speakers, the internal organs, if they are functioning properly, we have less chances of developing metabolic disorders. So to take care of the internal organs, we should do proper asana and pranayama. So asanas already we have mentioned: Matsyendrasana, Mayurasana, Vakrasana, Ustrasana, Mandukasana, Shashakasana. So that will mainly act on the internal organs which are in the abdomen. So after doing this asanas, few pranayamas. One is Anulom Vilom. This will help to relieve everybody from the stress, including health workers to the patients. Then comes our Ujjayi Pranayama for all thyroid disorders. Hold your throat tightly and breathe in. So Ujjayi Pranayama. Bastrika for proper breathing, proper oxygen supply through lungs. Bastrika. Then Kapalbhati, tuck in your stomach. Then Omkara. And just focus on your breathing. Relax, forget everything that is outside. Go in and focus yourself on the breathing, inhalation, exhalation. So if all of us can practice at least 10 minutes daily, I'm sure we will all get immense benefits, and the type 1 diabetic children at Haridwar are the living example for that. Thank you one and all. Namaskar.
So I think we're coming towards the end. My grateful thanks to all the panelists, Dr. Pratik Chaudhary from England, Dr. Srikanta from Bangalore, Dr. Ravi Kant from Uttarakhand, and Swamiji from Haridwar. This is a beautiful and enlightening experience. You people are doing wonderful work all over the world and doing so much good work for type 1 diabetics, and there is so much hope you gave. You told us a message of hope, a message of technology, a message of how to manage mind. It was so beautiful. I learned so many new things today. I hope everybody else listening must have learned that too. And I really am grateful to you all. I'm also grateful to American Association of Yoga and Meditation for providing this platform through which this webinar came to you. And my grateful thanks also to Anjali ji and Somaya ji. Anjali Deshmukh is a tireless worker. You do not know how much background work goes into making all this. We just come and speak, but they make it happen. So I'm grateful to both of them. And Anjali ji, can you just put on the next webinar that we have coming up on the screen for everybody to watch? Or Somaya ji? So anyway, this should be available on our website. It says it's on my ticker. I can't see it. What is a ticker? Okay, so the next seminar is on the 27th of September at 8 p.m. Indian Standard Time. It'll be at 9:30 p.m. Central Time in the USA. And the next seminar will be on COVID-19 therapeutics, where we stand now. So please come and join us. Thank you for joining. Thank you for being with us. And my grateful thanks to you all for being here. Namaskar. Thank you.